My understanding is that the additional vaccine that was talked about this week will likely be coming in June. And we have always said that the 4-month interval between first and second doses is in the case of vaccine shortage. And the purpose of that is to be able to provide the high level of protection of a first dose to as many Albertans as possible, as quickly as possible. But as we complete those first doses and have additional vaccine supply, we will be offering second doses as soon as we are able to, dependent on that vaccine supply. So we'll just have to see how those additional doses that are coming in June allow us to begin the second doses as quickly as we are able to. We are waiting for the perspective of the National Advisory Committee on Immunization to help us understand if there are certain groups of people for whom a shorter interval would be recommended. Because that particular research that you're talking about, particularly with respect to cancer patients, was looking at antibody levels. So I want to be clear that what that research looked at was, again, levels of antibodies after a first and second dose of vaccine when the second doses were given at different time levels. And that's really important information to consider, so we will be considering it. But the other thing that's important to consider is that we have really good real-world evidence on the effectiveness of the vaccine at preventing infections, hospitalizations, and deaths in older people. So in the UK and in Quebec, where they had a longer interval between first and second doses, and they were able to watch the impact of that first dose of Pfizer on people who lived in long-term care facilities, on people over the age of 80. What they actually saw is that the antibodies don't tell the whole story, and that the protection against infection, against death, against hospitalization was very high even in those older people. So we have very good real-world data from that age perspective. Unfortunately, we don't have that same real-world data from cancer patients, and again, we'll be looking very closely at the recommendations of the National Advisory Committee to understand if there are certain groups for whom we may want to have a shorter interval. But again, I want to emphasize that an individual is protected not only by the dose they receive, but by the doses that the people around them receive. And the faster we can have protection in our population, the more quickly we'll be able to, again, offer that both individual and the collective protection that vaccines can offer.